Greetings, I'm Matthew Balti with the Acoustic Neuroma Association. I'd like to welcome everyone to our ANAwareness Week. In a moment, we'll hear from a member of the ANA Medical Advisory Board, Dr. Megan Sherod, from the University of Central Florida, and her presentation of anxiety, depression, and the neurocognitive effects of acoustic neuroma. First, I'd like to handle a few quick items. If you have a question during the presentation and you are watching on Zoom, you can just write that in the Q&A section, which can be found at the bottom of your screen. If you are joining us on Facebook, your questions can be written in the comments section. We may be able to have questions answered as we go through the presentation, but afterwards we will get to as many as we can. Captions are available for this presentation. You can turn those on at the bottom of your screen as well. This presentation is being recorded, and you'll be able to find this in our webinar library on the ANA website at anausa.org. That is a terrific resource for so many topics you may have an interest in. There's a search option in there as well, so patients can find just what they are looking for. Lastly, a reminder to keep an eye on our social media. This week, during ANAwareness Week especially, we're on Facebook, Instagram, even LinkedIn, and you can learn about the resources available and how you can be more involved with the ANA. The ANA is here to help, so please access those opportunities. And now, Dr. Sherod, if you'd like to introduce yourself, we can get started.
Hi, everybody. Thank you so much for joining me on this Thursday morning. I hope that the weather where you are is much cooler than it is here in Orlando, where it is currently 110 degrees. I'm going to go ahead and share my screen so that we can begin. All right, hopefully everybody can see that. So again, I am Dr. Sherod. I am a neuropsychologist. I am a clinical professor at the University of Central Florida in the Department of Psychology. And today I'm going to be talking to you about several different things. What I want to start with is talking about anxiety. So anxiety has both a physiological or a biological component, as well as a psychological component when it comes to acoustic neuroma, vestibular schwannomas. So physiologically, if you look here on my screen, you can see where the tumor sits. Okay, it's going to sit right here between the cerebellum and the brainstem. And so this part, the tumor is actually sitting on the part of the brain that is responsible for panic attacks. And it also disrupts the flow of our happy chemicals, our neurotransmitters, specifically serotonin and dopamine. So what I've done here is I have placed, if you can see this black circle, okay, this black circle, this part is called the parabrachial nucleus. And the parabrachial nucleus is really sort of an old, almost evolutionary part of the brain that takes information from our vestibular system, which helps with our balance, with our posture, with keeping us upright. And it also helps organize information that is coming from our senses, our sensory information. So this would be things that we see, things that we hear, things that we smell, things that we taste, things that we touch. And all of this information is integrated right here at the parabrachial nucleus. So it's a really important part of the brain. All parts of the brain are important, but some of them affect us more directly than others. And so where all of this information comes together is right where your AN, your VS sits. And so this part of the brain is also important in recognizing information in our environment that might cause us to be afraid. So this part of the brain is really known for anxiety, for fear, for panic, and then something called avoidance conditioning. And avoidance conditioning is when we do something to avoid feeling anxious. So for example, if you're not a huge fan of going to the dentist and your dentist appointment is coming up, you might be feeling a lot of anxiety about that. And to the point where the anxiety becomes so uncomfortable that you call up and you cancel the appointment, you avoid the appointment. And we are conditioned as human beings to try to avoid feeling uncomfortable. So if you have something in your brain like an AN or VS that is putting pressure on this part of the brain, the parabrachial nucleus, then you might start feeling anxiety that kind of feels like it comes out of the blue. where you might be walking in the grocery store, you might be sitting at home, and you have this sense, this feeling of anxiety, this feeling of dread that feels like it just came out of the blue, that you can't place where it's coming from. And if that has happened to you, I would like for you to take away from this talk that there is both a physiological reason for that as well as a psychological reason for that. So let's talk a little bit about what anxiety is. Anxiety is sort of this umbrella term that encapsulates a lot of different symptoms. Some people experience anxiety as a racing of the heart, a quickening of their breathing, maybe sweaty palms, but other people might experience it as racing thoughts or just a general sense of unease. Maybe they can't even identify where that unease is coming from. And so anxiety, worry, fear, panic, all of these things, all of these emotions are intertwined, and they involve these parts of the brain, but also different chemicals. So there's chemicals in our brain, dopamine and serotonin, that are known as our happy chemicals. And when anything changes in our brain, anything at all, whether that is the development of a tumor, or for other patient populations, it could be a concussion, a brain injury, a stroke. Dopamine is one of the chemicals that actually helps our brain recover. It responds to any sort of inflammation. Its purpose is to help get injured areas of the brain back online. And so when dopamine is disrupted, then our thinking abilities are disrupted. And dopamine and serotonin are really good friends. They kind of hang out together. And serotonin is our happy chemical. If we don't have enough serotonin, then we can experience feelings of depression or anxiety. When you first hear your diagnosis of ANVS, oftentimes for most people, there is anxiety about that diagnosis and about treatment options, specifically which treatment is going to be right for you. As you all know better than anybody, each of the treatments needs to be individualized. And talking with your healthcare providers about what treatment is best for you will really be determined by what could be affected in terms of the type of treatment that you receive, whether you undergo radiation or whether you undergo surgery, or whether you are maybe doing a watching and waiting. There's also what we call a priming effect of anxiety symptoms that can play a part in worsening of balance. So we look to where we are afraid. So when you are out and about, whether it is in your house or whether you are outside, you're walking on uneven surfaces, or you're looking ahead to, there might be stairs or a curb that you need to negotiate, you are going to be looking there, and you will tune out anything else in your environment that might not seem like it's going to play a part in where you're walking, such as a cyclist, a bicyclist that is 30 feet away. You might not pay attention to them. And so we can actually have what we call visual inattention to our environment. Because we're so focused on making sure that we don't trip and fall, we can lose sight of other things in our visual environment. And this can actually lead to a worsening of our balance, where we feel anxious about navigating the path in front of us. That makes us feel a little bit less secure in our balance, which then creates more anxiety. And so it can kind of have this circular effect. Dizziness. Dizziness can be both a symptom of anxiety as well as a vestibular disorder issue. Different parts of our brain are also going to play a part in anxiety symptoms, and they could be affected by the tumor or by the treatment. As I mentioned earlier, we have chemicals in our brain that help us manage our movements with dopamine, but also our happy chemicals, and that can be disrupted. There are downstream effects, both because of the tumor, but also resecting the tumor that can affect that. I'll talk about that more in just a second. And then we can also have vertigo. Vertigo can increase anxiety, which can then make us, feel a little bit less steady on our feet, which then can increase the vertigo. So again, this whole idea of this cycle of anxiety and its implication in balance and how it can throw us off balance is something that many of you might have experienced. There can also be anxiety associated with watching and waiting before treatment. As you get closer to the new scans, whether you're at 1 month, 3 months, 6 months, as you get closer to that scan time, you might experience feelings of anxiety, worry that either if you are post-surgery that the tumor has returned, or if you are pre-surgery or pre-treatment, worrying that the tumor has gotten bigger. And so again, anxiety you can experience anxiety because of a lot of different reasons, both physiologically because of where the tumor is, but also because this is a really anxiety-provoking situation. This is sort of an extraordinary experience that not everybody in the world undergoes. And so there's a lot of individual decisions that need to be made with you and your treatment providers. And so even talking with one another, you might not have experienced the same symptoms as somebody else. I'm so glad that we have this community so that way you all can feel supported and that you don't feel alone. At the same time, it is important to recognize that each of you has your own individual journey, and that what one of you experiences, another one of you might have a different experience. And maybe you're listening to this talk and saying, Dr. Sherod, I have not experienced anxiety at all. And that's great. I wish for all of you peace of mind. For some people, though, there might be anxiety about the post-surgery symptoms and outcomes. As you're talking with your treatment providers, you've probably been told a lot of different things that could happen. What we know is that both the cognitive effects as well as anxiety and depression has not been studied enough in people with AN and VS. So the little bit of literature that is out there suggests that anxiety is best managed really from the onset of the balance issues, the vestibular disorder. And most specifically, the little bit of research that is out there shows that cognitive behavior therapy with a therapist, either such as myself, a neuropsychologist, or a therapist that specializes in medical issues, or a health psychologist, as well as working side by side with a physical therapist, that these have the best treatment outcomes in terms of helping people with ANVS manage anxiety, and as we talk about in a second, depression. As I mentioned earlier, that sense of imbalance can lead to fear, panic, and even avoiding attending previously preferred activities, or going on outings, going to work. There might be some avoidance there because of a fear of falling, and that is really something that I hope to address, because my number one concern for all of my patients is their quality of life, and helping people who have had some sort of brain phenomenon get back to their previously preferred activities as much as possible. Let's talk a little bit about depression too. Depression is, again, it's an umbrella term, and about 40% of people with ANVS will experience some symptoms of depression. They might not meet criteria for a major depressive disorder, but depressive symptoms are fairly common in this patient population. So what does that look like? Feeling sad or blue about the diagnosis. One of the things as I've worked for many years with this patient population is this feeling that because the tumor is inside your head, that you have almost this invisible illness, that other people might look at you and say, well, you look okay, but you might not be feeling okay. You might be very aware of some of the difficulties that you have had, whether it's hearing, paying attention, memory, all of the cognitive aspects that we'll talk about in a minute, as well as the anxiety, depression, difficulty sleeping, all of the things that you're experiencing internally. Feeling sad or blue about changes in your activities or changes in your quality of life. This may have affected your ability to work, your ability to go to school. It may have affected your driving. It may have affected your confidence when it comes to the activities that you love. You might be feeling sad or blue about hearing loss, and that could be both pre-treatment as well as post-treatment. You might be feeling sad or blue if you've experienced sort of a facial palsy or a facial droop, or if your smile has been affected. We do see a trend towards an initial increase in symptoms of depression immediately following the treatment, particularly following surgical removal of the tumor. And this has to do with a couple of things. One is those initial symptoms immediately following the treatment, which typically get better over time. But then the other thing, again, comes back to that cascade of effects that the surgery might have or radiation might have on the neurotransmitters, again, particularly serotonin and dopamine, because as things in your brain have been disrupted and as different messages are having to find a detour around the tumor or around the part of the parts of the brain that were removed in order to resect the tumor, it can wreak a little havoc in your processing speed, in how quickly information gets into your brain and how quickly that you can respond to it. And it also can cause this cascade effect on decreasing serotonin as dopamine and serotonin try to even themselves out following treatment. Hearing loss and tinnitus have also been associated with reports of post-treatment depression. Again, not being able to participate in conversations as much as you used to because it's difficult to hear. That has played a significant part in people's reported depressive symptoms. We also tend to see higher rates of depression, post-surgical depression in women. Generally, when we look at the general population, at least in the US, we do see higher rates of depression in women overall as compared to men. But specifically within this population, and that seems to be linked more to women who've experienced changes in their facial features, facial droops, paralysis. And so that is something I definitely want to highlight, and I would like for all of you to be on the lookout for symptoms of depression, both in you or if you're a caregiver listening to this in your loved ones. Depression following surgery is more common in people with the least amount of hearing loss before surgery. And so it's believed that if you only have a little bit of hearing loss prior to the surgery and you have a lot of hearing loss following the surgery, that the difference there can play a part in that feeling like you've lost a significant amount of your hearing can play a part in increasing depressive symptoms versus people who had significant hearing loss before the surgery and then continue to have significant hearing loss following the surgery. There isn't that big of a change. Therefore, the depression might not be as severe or as intense as related to the amount of hearing loss before and after surgery. Facial palsy, the fear of permanent effects on the ability to move the facial muscles, has also been associated with depression following surgery, again, particularly for women. Continued balance issues following surgery and the impact of that on quality of life has also been associated with higher levels of depression. Fear, risk for falls, that may continue after treatment, which can affect your ability to participate in your previously preferred activities, which directly affects your quality of life. If you are not feeling comfortable, you're not feeling stable on your feet because playing golf or playing tennis or bowling or any of these activities that require balance and coordination, then you're not participating in things that you love to do, which is going to have a direct impact on your quality of life. Another thing that people may experience after, particularly after treatment, is this what we call spontaneous nystagmus. Nystagmus is where your eyes move rapidly, kind of uncontrollably. Typically, it's back and forth, side to side, but it can be up and down or it can be in a circle. And what this does is it can make things look shaky in your environment, and that can again contribute to this feeling of anxiety, this feeling of depression. So what people do to compensate for that is a person might tilt their heads from side to side in order to see more clearly, because tilting the head actually helps slow down the eye movements. And our vestibular system, our sense of balance, is very much dependent upon our eyes and our eyes' ability to focus on something. So there might be a secondary effect of having a concern about head tilt. Persistent nausea and vomiting can also impact quality of life. Wanting to be, close to a bathroom or someplace if you are feeling sick to your stomach, and just that feeling of nausea and vomiting it's not fun. That can directly impact your ability, your wanting to get up, to get out of the house, and to participate in your activities. And then finally, post-surgery increases in cytokines. Cytokines are these helper chemicals in the brain that help it repair, help things heal, and also, participate in helping to modulate pain. And so changes immediately following surgery in those cytokines and then the neurotransmitters like serotonin and dopamine that help regulate our mood also can help have us feeling completely not ourselves. And again, this is a direct effect of the treatment. It's a direct physiological effect of that. So if you find yourself feeling sad or blue or feeling anxious, and it seems like it just comes out of nowhere, and particularly if you are within the first 6 months of treatment, that is something that is a direct physiological cause. Your brain is trying to heal itself. And so my hope is that when you leave this talk today, that if you are experiencing those things, that you will give yourself a little bit of grace and understand that this is your brain's attempt to heal itself, and that it's going to flood your body and your nervous system with a bunch of chemicals as it tries to heal itself. But it takes time, and it takes longer for the brain to heal than anything else. A bruise on the brain, an injury to the brain, takes infinitely longer than it does to heal than it does a bruise on any other part of your skin or a broken bone. Okay, we're talking about 6 months minimum for that acute stages of recovery, and then another 6 months to 3 years for some people, they continue to recover different functions for the rest of their life, particularly if they are enrolled in cognitive rehabilitation, if that's something that's appropriate for them, continuing to work in physical therapy, or for those where it's appropriate, occupational therapy. So I also want to talk about, as we move into cognition, just wanted to give you a visual here of where the types of parts of the brain that are surrounding the cochlear nerve, the vestibular nerve, that merge together to form this cranial nerve 8 that is directly affected by the acoustic neuroma or the vestibular schwannoma. But there are other parts here in the inner ear that are going to be affected. And where the ANVS sits really it's almost like you have a tractor trailer that is sitting in the middle of a busy highway. So not only does it disrupt the areas immediately surrounding that tractor trailer, but it's also, you're going to get a backup from miles back, because messages that would typically take that pathway to get from one part of the brain to the other, there's going to be a bottleneck to go around that tumor, to go around to detour. And so you might have noticed that it takes you longer to process some information that previously you felt like came very quickly. And so I want to give you this visual so that you know exactly where that backup is. And depending upon how large your AN or VS is, that will determine in part how quickly you can take that detour, how quickly those messages can get through or get around the ANVS. And if you are in the watching and waiting group, you might see a change over time in your processing speed, meaning that it might take you a little bit longer, noticeably longer, for you to be able to process information coming in and then being able to respond and information getting back out. So as we move into the cognitive part of this, again, not everyone is going to experience all of these symptoms. So I'm casting a large net. Every brain is different. Every brain takes in information and stores it individually. So what I mean by that, if I were to say the word bat, for some of you, bat might be associated with baseball glove. And for others of you, bat might be associated with Halloween or with the zoo. And so information is going to be stored in the brain according to how you determine its relevancy. So information is stored in different places in different brains. And this is particularly true for memory and for language. So some of you may have experienced some of these symptoms. Some of you might not have experienced any of these symptoms. And that's okay. I just want to cast a wide net to be able to talk about these things in case any of you have been experiencing these things. I want you to understand what it is and why. So I'm going to talk about deficits in auditory and visual attention, deficits in your visual spatial abilities, deficits in your ability to localize sounds, changes in your balance and your vestibular functioning, and also deficits in your muscle memory. So let's start with attention. So in order for us to remember information, it has to get in the first place. And this is sort of the first line where the ANVS will disrupt your attention, is particularly auditory attention. So whether it's tinnitus, whether it's postural instability, anxiety, nausea, headache, people with ANVS are more prone to being distracted by any of these symptoms. If you're distracted, if you're having a difficult time paying attention, or you just can't hear because the tinnitus is too loud, it's going to make it difficult for you to remember something. If we can't hear it, if we can't attend to it, then information cannot make it into short-term and then long-term memory. So attention is necessary for memory. If your attention declines, then so does your memory. So if you've noticed a change in your ability to remember things that you hear, this is why. It can also disrupt your visual attention. Your visual attention can be disrupted by the ANVS due to anxiety. Like I mentioned earlier about we have that gaze fixation, we look to where we are afraid, we look for those danger areas in our environment, and that can affect our balance and our movement and our ability to attend to something that is not directly in front of us, or might make it difficult for us to attend to a bicyclist that is 30 feet away, but is coming towards us when we are just focused on the path immediately in front of us. And so we may not see that bicyclist headed towards us until they're almost upon us. If we experience a disruption in our visual attention, then the visual information doesn't make it into memory. Again, if we can't attend to it, then we can't remember it. Visual spatial abilities may also have been affected. Our visual spatial abilities are our abilities to scan information, to scan an object, scan an environment. This could be a textbook, this could be a newspaper article, this could be something that you're reading on social media, or this could be, the environment out in front of you. This could affect driving, it could affect bicycling, and it could affect walking. And so our visual spatial abilities are the abilities of our eyes to take in information and then to organize that information. This can include depth perception, being able to judge the distance between you and something else. This could be localizing objects and ourselves and where we are in space. This goes beyond just our eyesight. So even if you have perfect vision, 20/20 vision, where the disruption occurs is further back in the brain. So we take in information with our eyes at the front of our head, but where visual information is processed is actually at the very back of our head, and it's at the very back, and it's also processed upside down. And so information has to go by the VSAN in order to get to the parts of the brain that process vision. So many people with visual spatial dysfunction actually have adequate vision. It's how visual information is processed. How we determine depth and how we organize information in space is going to be controlled by parts of the brain that are very close to where the ANVSs typically occur. So if you have a difficult time misreaching, meaning you overreach for something or you underreach, you don't reach far enough if you're grabbing a glass of water, or if you go to step up, or step down, you might misjudge that depth, or otherwise just successfully negotiating spaces, bumping into walls, bumping into furniture. That all can be directly caused by the ANVS. So I have a picture here just kind of showing you how different parts of our brain process information. So where the pictures are is going to be the back of the brain. And then the front of the brain is here to the very left of my screen. So this is as if we're looking at the brain through the person's left ear. So down here at the bottom is where our brain processes what it is that we're looking at. And then up at the top is the where pathway and where things are located in space. And this is, again, both of these pathways are what help us to be successful in negotiating our environment. So let's see where we put the ANVS is going to be right in the middle of these two pathways. So information that is coming in from our eyes there at the very front of our brain that needs to get to the very back all has to go around this ANVS in order for the information to be processed successfully. And there can be a bottleneck. It can take a while for things to get through. And so this is where it might seem like things are moving in slow motion, that your brain is not processing information as quickly as it once did. Or it might mean that you're processing information, if you were to go catch a ball, that the ball might hit you before you actually can put your hands up and catch it effectively. Other things that are affected are sound localization. So if any of you have ever been in another room of your house and somebody comes in, or you're walking in and somebody says, "I'm in here," and you have no idea where here is, that's sound localization. It's trying to determine where a sound is coming from. So if one or both ears experience hearing loss, then it can become very difficult to determine where that sound is coming from, whether it's a voice, whether it's beeping from a smoke detector, the ring of a cell phone. It can be very difficult for you to figure out where that sound is coming from. Hearing loss affects our ability to appreciate the timing of sounds. Tinnitus can also disrupt this. So what happens is that different sounds are going to reach the cochlea. The cochlea is the part of our brain that is important for processing sounds. It sits in our inner ear, and it's what turns sounds into neural energy that our brain can understand. So it takes sound waves and turns it into brain energy, and then sends that brain energy to the parts of the brain in the auditory cortex, which is on the sides of the heads, that processes information and helps us understand sounds. But what happens when you have hearing loss is that sounds are going to reach the cochleas in either ear at different times. And in order for us to successfully localize a sound, they need to reach the cochlea at the exact same time. So there's kind of almost like an echo. It would be trying to locate a cell phone in the middle of the Grand Canyon and trying to figure out where that sound is coming from when there are different echoes going on, because information is reaching the brain at different times. So here's just a little schematic of our outer ear all the way to inner ear. So our outer ear, which is that fleshy part, the pinna, is going to act as sort of like a funnel that's going to funnel all the sounds into the ear canal. Those sound waves are going to bounce against the eardrum, which is then going to cause the little tiny bones, the malleus, the stapes, and the incus, to vibrate. And when those vibrate, those bones are going to take sound waves and then turn that into brain energy, turn that into a neural impulse, where the stapes in particular is going to vibrate against the cochlea. And then once inside the cochlea, information is then coded based on its frequency. So how loud and how many times those bones are going to cause the cochlea to vibrate will tell us what the sound is. And so your ANVS is going to be sitting there on top of the cochlea. And so that can cause the sounds to be muted. It can cause a disruption where the neural information doesn't make it out of the cochlea to go to the different parts of the brain at all. And so this is, again, where that processing speed is going to be slowed for information that you're taking in, such as listening to a conversation. And then also over here on the right, what I have where different frequencies are stored, different frequencies are recognized by the cochlea. So based on what part of the cochlea is going to vibrate the most is going to determine the frequency. So the pitch, the tone of different voices, of different music. So it might be easier for you to hear certain voices and certain types of music versus other types of music, depending upon the frequency and what part of the cochlea your AN or VS is affecting. And as you can see, here is where the AN and the VS sits in each of those schematics. So moving on to the next part, which is looking at how vestibular function is affected. So our vestibular function is our ability to maintain our balance, our muscle memory, our body's ability to keep us upright. So in order to know where our body is in space and then to successfully move throughout our environment, we have to have an adequately functioning vestibular system. And the vestibular system is made up of several different structures. So it's made up of some structures in our inner ear, which are some of the ones I just showed you on that schematic. The semicircular canals and the otolith organs, these are parts that are located just off the cochlea, and these parts send information about our head's position and our head movement to other parts of the brain via the vestibular nerve. And so if you have a vestibular schwannoma that is affecting the vestibular nerve, then it's going to be difficult for your brain to know where the head is in relation to the rest of your body and in the relation to where it is in space. So if you have an acoustic neuroma or vestibular schwannoma that's present, then the vestibular nerve cannot send information as efficiently if it's able to send it at all. And so this is what disrupts your balance. The vestibular nerve is then going to send information to the spinal cord to help keep you upright. The muscles that control the eyes. Again, this is where, if we spin around, in order to not get dizzy, we have to fix our gaze on one unmoving object. So when we watch ice skaters, or when we watch dancers who are spinning around very, very quickly, in order for them to not fall over, they have to fix their gaze on a focal point each time that they turn around so that they don't feel dizzy. If your eyes are moving all around and they're trying to find a fixation point, then it can make it really difficult for you to not feel dizzy and for you to remain upright. So the spinal cord, muscles that control our eyes, our cerebellum, which is located at the very back of our head. This is very important for movement. It's also important for muscle tone and for posture. And it's also important for muscle memory, things that we have done over and over and over again, such as maybe typing on a keyboard or riding a bicycle. All of those memories of how to do those things are stored in the cerebellum. And then finally, our motor cortex, which is located at the very front of our brain. And this is important for coordinating movement. So this is going to be important for things such as dance or golf or any sort of type of sport, or running or walking quickly, or even walking very slowly. All of these things are going to work together in order for you to remain upright and for you to achieve your motor goal. So the vestibular system is what's responsible for us feeling dizzy after we've been spun around. In order to stop feeling dizzy, our eyes are going to search for a stable fixation point, a gaze fixation point, so that we have one stable image on our retina when our head moves. And so again, if you are experiencing any sort of nystagmus where your eyes are moving back and forth uncontrollably, or if you are having a difficult time fixating on a point in front of you, then of course you're going to feel dizzy because your brain is not sure of where you are in space and your eyes aren't really cooperating. And if any of those things, if the vestibular nerve sending information to the spinal cord, to the muscles that control the eyes, to the cerebellum, to the motor cortex, if any of these things wind up getting out of sync, then you're going to feel dizzy and you could fall over. So again, when the vestibular system is disrupted, messages are not about where our head and our body is in space are not sent efficiently. And so if we can't locate ourselves in space, we can't make sense of movement. And so this is why you wind up feeling wobbly. And when you have a lag in vestibular information being received by certain parts of the brain, that dizziness, that's really what causes nausea and vomiting, is because different parts of your brain are receiving vestibular information at different times. And so they're almost competing against one another. And that competition for where things are in space, that motion sickness that you might experience, that is what causes the nausea and the vomiting. When the inner ear is disrupted, so that area where those small bones are and where the cochlea is, the brain is going to depend on other structures like our eyes in order to determine its location in space. So again, when the acoustic neuroma, vestibular schwannoma has sort of made it difficult for that inner ear to make sense of things, our body's going to say, okay, there's a backup system. Now I'll rely on my eyes. But then your eyes are going to be constantly scanning your environment in order to tell your brain where the body is in space. And so this is what leads to visual inattention to other items in your environment, particularly things that are closer to your body that you might visually tune out because you're looking further ahead to let your brain know this is where I am in space. And deficits in muscle memory can affect quality of life. So when our vestibular system is affected, our body is going to struggle to adjust our posture, our muscle tone, our positioning in order to complete a motor task. So for example, if you've ever done, I remember in high school, they did this, what they thought would be a fun little game, our PE teachers, where you place your forehead on the grip of a baseball bat and you spin around the bat, and then you try to walk in a straight line. And it can't be done because you have had no gaze fixation point. And so the vestibular system is thrown off. When we don't know where our bodies are in space, we are easily thrown off when trying to balance. And this could be trying to swing a golf club or a baseball bat or throwing a bowling ball or trying to dance or riding a bicycle or a horse or trying to run, skip, or jump, or for many of you, maybe, interacting with your children, grandchildren, friends' children, just trying to play sort of simple outside games may be difficult. So in terms of treatments, with anxiety and or depression, one thing that may help, and I'm going to give you lots of different suggestions. What works for one person might not work for somebody else. So some of you, maybe meditation would be helpful. And Headspace is an app that I really like. I use it myself because I'm the type of person where I need somebody to sort of tell me what to do. So they have a lot of guided meditation. So when we think of meditation, a lot of times people will think about sitting still and everything is quiet. And sometimes that might not work for you if you're the type of person who starts thinking about a grocery list or starts thinking about the 4 other things they have to do that day. So guided meditation might be a better choice for you, where the instructor is in a very calming voice, sort of telling you what to imagine or telling you what to listen to, telling you exactly what you need to do to meditate, to be mindful, to stay in that moment, which is usually, thinking about what you see, what you smell, what you hear, what you taste, what you feel. Support groups. ANA is amazing in the level of support and resources that are available to you. So if you haven't joined a support group, I would just like to put a plug in for the amazing support groups that we have throughout the entire country and internationally. If you are experiencing levels of anxiety and depression to where it is interfering with your ability to get through the day, then I would recommend that you speak with a therapist, specifically somebody who does what we call cognitive behavior therapy. This can be with a psychologist or neuropsychologist like myself, or a mental health counselor that specializes in health psychology. The other thing is just making sure that you give yourself time to heal. These are not things that, that ANVS took its time in growing, and it will take its time to heal as well. So having some grace with yourself, practicing some of these things, practicing some deep breathing, or other types of treatments that might be appropriate for you in terms of managing anxiety and depression, giving yourself some grace, allowing yourself some time to heal. If you're experiencing difficulty with auditory and visual attention and thus memory, writing down or using smart devices now are incredible in terms of what they can do, but taking voice memos, taking pictures of things, writing things down in the notes section, or, keeping a tiny notebook with you so that you can write things down, things that are important to be remembered. Have physicians print out office notes for you before you leave their office so that you have that going home, or ask them if it's okay if they record, if you record them as they are talking about, treatment options. This is a lot of information to take in all at one time. Practice games designed to improve attention and memory. Things like Simon, the thing with the little 4 colored discs that you have to press in a certain order. There's lots of online brain training games, memory games, bingo, musical chairs, learning new song lyrics, chain games like telephone, where repetition games where you repeat and recall a list of words like a grocery list, listen to a new story, repeat the story back, and again, allowing yourself time to practice these things and giving yourself time. For visual spatial abilities, if it's something math related, using graph paper to organize your computations. If you are experiencing misstepping, misreaching, sometimes covering the eye on the same side as the tumor can help. And then it will force the one eye, which might have more of an unobstructed pathway for visual information to get to the back of the brain, and also to help with the vestibular system, that can be helpful. So covering the eye on the same side of the tumor can help. For if you are reading and your eyes are skipping words or lines, then utilize a reading window, which is where you take a Post-it and just cut out a little tiny window in the middle, and you use that as a marker as you're going along and read with it, so that only 1 or 2 words appear in the window at one time. A great way to get family members involved in your recovery is playing games. So practicing games that are designed to improve visual spatial abilities, like jigsaw puzzles, Jenga, 3D puzzles, Legos, Sudoku, hidden objects, coloring books, paint by number. All of these things can, especially for kids who really want to be helpful, these are things that they can help you with. And again, practice and time. You're going to see that in each of these, practice and time is going to be important. If you're having difficulty with localizing sound, particularly if the sound involves another person, ask them to be specific. So instead of saying, I'm in here, ask them to say, I'm in the kitchen, or I'm in the bedroom at the top of the stairs. If the sound involves your cell phone, cell phones can have, they can turn on blinking lights and haptics that will shake to try to engage as many different sensations as possible to assist with locating the cell phone. If the sound involves an animal like a pet, consider there are LED pet collars that you can put on so that you can see them. If you can't hear them, you can at least see, especially if they're outside at night. The LED lights on the collars can help you localize them in space. Particularly if you're getting up in the middle of the night too and you're not sure of your balance. Many a time I've had patients who have fallen because they have tripped over an animal in the middle of the night. If sounds are too loud, so phonophobia, meaning you're sensitive to sounds, soft construction grade disposable earplugs are great. You can get those at Home Depot. I know, Carrie's, you can buy them by the thousands there. Noise machines that contain brown noise, pink noise, blue noise, yellow noise, in addition to white noise. There are different ways for you to determine which noise color is the best for you. White noise is that staticky noise, which for some people might be helpful, but for other people can be really annoying. So there are different types of noises, and you each will have the color that speaks to you. For some people, brown noise would be most appropriate. For other people, pink noise is most appropriate. For me, of all of these, blue noise is the most comfortable for me. Having a whiteboard in your home, set each day or part of the day to different noise levels based on your threshold at that time. So if you are feeling like you're feeling overwhelmed, if you need people to be a little more quiet, then you can write on the whiteboard, marshmallow toes, okay, and whispers for quiet. Or if, dog paws, inside voices for moderate noise, if that's okay. Or if you're not feeling as sensitive to noises, you can put on there galloping horses or outside voices are appropriate. But this will let family members know sort of where you're at each day and what level of sound you can tolerate. If you're experiencing this difficulty with vestibular functioning, so you're feeling dizzy, if you're experiencing vertigo, nausea, vomiting, persistent balance issues are common both before and after treatment. Vertigo is common before and after treatment, and nausea is usually secondary to the vertigo. Medication might be able to help, at least with the nausea and the vertigo. So I would encourage you to speak with a healthcare provider about whether or not medication is an option for you. If medication is not an option, or if that's just something that you don't feel comfortable with, then I would strongly encourage you to consider seeking an evaluation and treatment from a certified vestibular therapist. This is a physical therapist that has additional specialization and certification in treating vestibular disorders. So not every physical therapist is going to be a certified vestibular therapist, but every certified vestibular therapist will be a physical therapist. So I would encourage you to speak with some of those people. And then difficulty with muscle memory. Practice, relearn to do your beloved activities, modifying the activity to fit your level of ability. So if you're feeling a little unsteady on your feet, there are chair exercises that you can do. There are things like modified golf, modified bowling, modified cycling, pretty much any activity that you love to do. I'm pretty sure that either I or one of my colleagues has modified to fit the level of ability. talking with disability personal trainers. These are certified personal trainers that specialize in working with people with disabilities, chronic illnesses, or older adults with mobility issues. That could be an option for you too. And there are many clinics and many, many different fitness centers throughout the country that have at least one member on staff that specialize in working with people with different levels of abilities. So I would encourage you to reach out to those folks if that's something that you want to do. These are just the references that I have for some of the pictures in case you're interested. And then this is my email that I'll leave up there for just a minute. And then I'll ask Matt, Stephanie, if you guys, if you want to take over, I can stop sharing my screen here and see what kind of questions if we have. I know that was a lot of information in a very short period of time, but I would be happy to answer any questions that y'all might have.
Yeah, Dr. Sherod, thank you so much. That was a terrific and very full presentation. So we certainly appreciate you taking the time to share with us. We do have some questions here. Someone was wondering, what is health psychology as opposed to other types of mental health counseling?
That is a great question. So health psychologists are clinical psychologists, but they specifically focus on health-related behaviors and working with people with different medical illnesses. So it's typically additional training beyond counseling, but specific people who have a specific focus on health-related things like if you have diabetes and working with a person with, or a new diagnosis of diabetes, working with somebody to help manage insulin, manage medications. Or, for example, my background is in clinical and health psychology, so I work a lot with people with brain tumors, with stroke. So I'm a neuropsychologist, but I also have the training in health psychology to work with people. I have specific training working with people with chronic medical illnesses. So it's really somebody who focuses on anxiety, depression, and other types of mental health issues that are directly related to health-related health behavior issues.
Great, thank you. And related off of that, somebody was curious, how do they find a neuropsychologist near them? Is there some way or what kind of, what suggestions would you have there?
Honestly, this comes up a lot when I talk with different members of different support groups. Honestly, if you want to take down my email and email me, I would be happy to help find you somebody in your area. Specifically because different neuropsychologists focus on different things. And so there are a lot of neuropsychologists that might focus specifically in working with people, say with autism spectrum disorder. That wouldn't be the most appropriate neuropsychologist for you to go see. We would want to work with somebody who's a more traditional neuropsychologist who focuses on, brain behavior and the impact of specifically of changes in brain and behavior. So I would say, feel free to reach out to me. There's no real, unfortunately, there's no directory of neuropsychologists out there because different people with different backgrounds might say that they're a neuropsychologist. And it's sort of like trying to choose a specialist from a large directory of primary care providers.
Got it. And again, that email, I believe, was megan.sherod@ucf.edu. Okay.
Yes.
I know it's up there for a couple.
I'll go ahead and put that in the chat if you want to just go ahead and you can share that with folks.
Yeah. And also, as we post this on ANAusa.org, people will be able to go to the end and see it there. Towards the end of your presentation, you were sharing a lot of great ways about how people can stay active, a lot of those different games and modified sports, things of that nature. Someone was wondering if you could provide any communication tips for family members to help them to understand what they're going through. What would those be?
In terms of explaining to them what they're going through, is that the question? Is like how to help family members understand what it's like living with ANVS?
That, and also communication tips for whenever they're just communicating with each other, not just what they're going through, but also how they can kind of affect that and help them through it through different communication tactics.
Okay. Well, one of the things that we have available to everybody is actually the understanding emotional and cognitive behavioral changes. And this is something that I wrote a couple of years ago now. I think that is a good book to hand to loved ones, adults. We're still working on sort of the children's book aspect of that. But I think that's a good way to sort of help people understand a little bit about what the experience is like. I also have put together a bunch of websites that almost kind of immerse loved ones, caregivers, friends into what it's like, what the experience is like. So there are different websites online that you can go to that helps them understand what tinnitus is like and how challenging tinnitus can be, just to navigate that communication. In terms of actually like being able to just get information out, especially if there's been any change in speech or difficulty in sort of hearing what other people say, especially if you have a family member or loved one who speaks really softly. I think that technology is the way to go. Specifically just either being able to text, or there are assistive communication devices. So I work a lot with people who have aphasia, who have developed an expressive language disorder. So they know what they want to say up here, but they can't get it out. And so we have different assistive communication devices where they touch something on either their iPhone or on an actual communication device, and it will read it to the listener so that they're able to communicate what it is that they're saying. I hope I'm answering the question. I hope that's, but there are lots of different places, and in fact, many speech language pathology clinics have this assistive devices, these available. Or there are also you can get things on Amazon, just depending upon how what your financial resources are. There are some that are very simple and are very inexpensive, all the way up to very complicated and very expensive sorts of devices. But you can look under it's AAC or ACD, so assisted communication devices or automated assisted communication.
Great, thank you. A patient was stating that if they start to notice some cognitive symptoms, once they start a treatment for them, how long can they expect until those begin to possibly improve?
It's going to depend. It depends, one, on whether or not they are in the watching and waiting stage, or if they are post-surgery or post-radiation. Post-surgery, what I tell my patients is that you imagine your brain is sort of like a pie. And as soon as you cut that pie, the pie is no longer whole, even if you don't take out a piece of that. And so we can't ever go back to 100%. But is it possible for people to get to 85, 90%? Absolutely. Part of that might involve, if you have a very, very large ANVS, it might involve training other parts of the brain to take over for the parts of the brain that were affected by the ANVS and by the resection. If you have a smaller ANVS, then it could be that areas that were immediately beside the ANVS, that those parts of the brain can take over. So it just depends on how much of the brain needs to be rewired. And it also depends on what things are important to you. So for example, if you were never a musician or needed to read music, then that wouldn't be something that you would necessarily need for retraining. So part of this really needs to be individualized training. But if you're somebody who, in order to return back to work, needs to be able to, to organize things very quickly, it might be that maybe technology becomes your best friend. And there are all kinds of things all kinds of apps that can help you organize information, help you memorize things, help train your brain to do that. So, I have some people that have been they haven't been seeing me for 16 years, but they're 16 years post-event, and they're still participating in different therapies. So I talk about cognitive therapies the same way I do with physical therapy. The more you do, the more you practice, the more that you are able to engage those muscles, and the more that you engage in that movement, the stronger you're going to be, right? The more you're going to be able to build up that function. It's the same way with your brain. It's sort of, if you don't use it, you will lose it. And so You want to make sure that you are practicing some of these things, every day, whether it's you do Sudokus on Mondays and you do crossword puzzles on Tuesdays, you do word searches on Wednesdays. Again, just taking 15 minutes out of your day to just say, okay, this is my time. I would suggest more time immediately following surgery. So immediately following surgery, we want to work on maybe an hour a day. And until you get to the point where you're able to do those tasks a little more quickly. And then kind of for maintenance being about 15 minutes. But I would say this is a lifelong thing. I think keeping your brain active is going to be really important for any population. We start to see things like dementia when people start to retire. So, if you are in a job that you love and physically you can do that job, I would say continue to do that as long as you possibly can to keep your mind and your body active. Because once your mind and your body stop being as active every day, it's going to start to lose things. So I'm going to say lifelong. I know that maybe some of our listeners might not want to hear that, but I would say continue to do these things lifelong.
Yeah, it's certainly something we can always continue to work on, and especially those cognitive things like you were mentioning. Dr. Sherod, thank you so much. We had a lot of great questions. We're kind of butting up against time here, but thank you so much for your presentation and everything that you do to partner with the ANA and help us to support patients and further the mission of the ANA. We truly appreciate you and your partnership with us.
You are so welcome. If anybody has questions that they want answered, that either if they're not able to attend any of my other talks, please feel free to email me. That's the best way to get in touch with me, and I will do my very best to help support you in your journey.
Awesome. Well, thank you so much, and thanks to everyone who joined us and for attending. And a reminder, you can find this webinar and many more resources at anausa.org. Many of the resources that Dr. Sherod also mentioned, you can find there as well. But thanks for joining, and have a great rest of your day.
Bye, everybody. Thank you.